Hello, are you one of the millions of people in the United States and or around the world who are living with a diagnosis, a life-threatening condition known as lupus? Has your doctor found that you have antibodies attacking your own tissue? Have they told you that this is an autoimmune disease, and the reason for the autoimmune disease is that your immune system, for some reason unknown, is attacking your own body, it turned on your own body? If that's what you've been told, and you're taking immunosuppressant medications and or steroids and or painkillers and or anti-inflammatories, and you're still living with these horrible symptoms from this lupus condition, you deserve to know more, and you deserve to get better, and you deserve to understand the science of what's really behind the reason for the, or the reasons for the autoimmune disease. If you want to know more about this, stay tuned. In this video, I'm going to do this in 3 parts. Part number 1, you're going to see a woman who came to my clinic. My name is Dr. Lonnie Herman, and I'm the creator of a functional neuro recovery therapy. And I've got a background, before I tell you about part 1, I've got a background in neuroimmunology, where I was taught by one of the world's most recognized immunologists. So before we go into that more, in part 1 of this video, you're going to see a video of a woman that I interviewed via Skype video recording. She lives in United Kingdom, and she came to my clinic back in August of 2018 after suffering for 18 years with lupus. 18 years. Let's put up the thumbnail. You'll see this video as I'm speaking right now. 18 years with symptoms of pain in the chest, pain in the spine, pain in the whole body from head to toe, extreme fatigue, extreme weakness, seizures, vomiting, irritable bowels, constant bloating, constant fevers of 18 years, low-grade temperature, 18 years of symptoms. She's doing so much better now. The medications never helped her get well, and she came here for answers. So in part 1, you're going to see a few minutes excerpt of the video that you're seeing the thumbnail up here. You can hear her describe of the recovery that she's having. And then in part 2, we're going to describe, I will describe the exam findings I discovered in her that have helped her when she followed their unique protocols, the customized protocols that my clinic and I designed for her. You will really be amazed, because I doubt that you've ever heard of these different kinds of exam findings in the kinds of exams that you've had done with your doctors, whether they're in the best hospital or the best laboratory or the best caring physician, whether it's a rheumatologist or an internist or a general doctor of any kind of physician. So you can be really amazed at these exam findings. And in part 3, we're going to play that clip again so you can really hear about what she's been through over the years. And then I'll put a link up underneath this video. There's a link to the entire testimonial that we did together. Okay? So let's get started with part 1, and I'll be back in just a moment.
The very first symptom I had was these violent seizures. And, you know, if anyone saw them, they would say this is epilepsy. So epileptic seizures, you know, these violent convulsions. If I was standing, I would fall down. You know, if I was lying down, my body would be shaking. If I was holding something, my hands would, you know, whatever I was holding would fall out of my hands. And then this would last, you know, from maybe a minute, maybe 10 minutes. So, you know, muscle spasms. But it would start off with this, what I call a storm in the brain, an electrical storm in the brain. And that's, you know, I would actually see lightning in my brain. I would see this and I would feel it. That's what I liken it to. It's an electrical storm. Patches, bald patches on my scalp. Hair loss. This was the second symptom. So, you know, it looked like alopecia. And there's a pattern, you know, so there's 2 lesions here, 2 here, 2 behind the ears, and 2 at the back of the head. So there's a clear pattern of the lesions. And then the hair loss, the hair thinning. I was weak, I was exhausted. My brain felt exhausted. I was lethargic, I felt very heavy, like I couldn't move. It was almost like, you know, walking felt like I'm dragging my body in water. It just felt so heavy. So the constant fever, this was a low-grade fever, you know, so in Celsius I would say it was about 38.5. I think that's about 101
I'm going to look
Fahrenheit. I'm not sure. So for most of the time, during these 18 years, it was a low-grade fever, but then it would flare up and it would last about 4 weeks. And it was, very, very high temperature to the point where I was, I would pass out and just end up in the hospital. They would basically give me injections to bring the temperature down. And, when I asked you...
Let's say, do you have any fevers now? Are you feeling better?
No.
Oh, no more fevers?
No, I have not been bedridden since I started treatment with you. I'm up and about. I can go all day.
Del, I want to make a point with people here. On a scale of 0 to 10, if 10 is the worst, fatigue, 10 is the worst level it could be. You said it was what level? 12. So it was worse.
It was 12.
Worse than the worst. And now it's been at what level is your energy now? So again, fatigue, let me put it in the same range of fatigue. 0 to 10 is your 12, you're worse. What is the level that you're at now?
3.
3. And that has been a pretty constant, consistent level of fatigue for you.
Yeah.
So we're looking at even better than 70 to 80% improvement in the energy level of your body.
So I have not had fever since the end of the second protocol.
Okay.
That was May of this year, 2019.
Excellent.
Improved digestion. I had gastrointestinal issues also accompanying all this, what we've mentioned. So for the 18 years, I had, severe bloating. I had either it was constipation or it was diarrhea. It was one of the two. I had these, issues with digestion. Had so much bloating.
I remember you coming here. You had this chronic cough that was not stopping.
Yeah.
How long did you have coughing for?
6 months. I was coughing non-stop every day, all night.
So now the coughing is totally gone.
Completely gone. Completely cleared.
It's been gone for how long?
It stopped at the end of the first protocol. It was completely cleared. Yeah.
Has that been done?
I had a lot of swelling in the hands and the ankles, the feet, the legs, lower legs. That's gone.
That's
completely
totally
fine.
And I think since I see here my notes, that was from November. I got that note from you, November of 2018. So we're looking at about 10 months, no more swelling in the feet and ankles. How long did you suffer the swelling in the feet, hands, and ankles? How long was that going on in your life prior to coming?
Again, the 18 years, it was when the whole thing started, with the seizures and fever. And this was since childhood. If we were on a flight for maybe 7-8 hours, I would be vomiting for most of that time. And then once I'd vomited the contents of my stomach, I was vomiting just nothing. It was crazy. It was crazy.
And that was a constant for you for years, and that's no more.
That's no more.
No more.
No. Nope.
And how long did that spine pain exist in your life for? How severe was it, and how long did you exist with that? Did that exist with you, I should say?
Yeah, it started when the seizure started. So again, 18 years, and I had pain not only in the spine but throughout the body. So literally from head to toe.
Yeah. And now is that spine pain or that head to toe pain that you're describing from the seizures, that whole incident, is that gone as well?
It's gone completely.
Completely gone.
Isn't that just incredible? I mean, her fevers of 18 years are completely gone. The vomiting that she had when traveling is completely gone. Her irritable bowel, it's not too good to be true. Her irritable bowels are completely gone. No more constipation, no more diarrhea, no more bloating. The pain in the chest, gone. The pain in her spine, gone. The pain from head to toe, gone. The chronic fatigue of 0 to 10, 10 is the worst. She was at a 12, she said. She's down to a 3. She's so much better she can go all day. She does not feel heavy anymore. She does not have the weakness anymore. The swelling in the joints, gone. And it's not too good to be true. And there she is describing it. Now again, she wanted her privacy. She wanted to keep herself private. She doesn't want to be seen on social media. So we're just grateful that she shared this testimonial with you, because you deserve to know, you deserve to get better, that there's another way. There's another way for you to get better. So let's go into the exam findings right now in part 2 of this video. In August, again, the coughing, that she was coughing for 6 months. 6 months, 24 hours a day, 7 days a week, coughing for 6 months, uncontrollable. Doctors couldn't figure out the coughing is gone. And she stayed there only with my help. Before I get into these exam findings, the purpose of this video is to help you realize that there is another way to get well. And yes, I am telling you to come to my clinic for you to get under my care. And yes, I'm going to perform a different, unique exam on you that can help you figure out what it is that's causing your condition and help you whether it's going to be as fast as her getting well or it's going to be a bit slower. You can get well, you will get well. It's just going to take some time. For some people, it's going to be fast for others. So that is the purpose of this video, to help you realize and come into this clinic here and to help me help you get well. Now, I found in her bronchioles, which are the tubes inside the lungs that bring the air into the lungs, she had Coxiella burnetii bacteria. She also had in her bronchioles, she had the St. Louis encephalitis virus. Now, I found those in the first examination. There's a bit more in the lungs that I found in her second exam because the coughing wasn't gone completely from that first protocol. I found in her cerebral spinal fluid through that first exam. The cerebral spinal fluid, I found infections. Now, the cerebral spinal fluid is fluid that's in and around your brain and spinal cord. Anytime there's infection in the spinal fluid, that fluid gets into the brain and spinal cord, causes the brain and spinal cord to be inflamed, and any symptom can appear in the body, whether it's pain in the body, it's malfunction of an organ, malfunction of your intestines, malfunction of your stomach, heart rate changes can occur, pain in the body can occur. I found that she had the West Nile virus in her cerebral spinal fluid. I found the dengue fever virus in her cerebral spinal fluid. The next finding was in her embryonic stem cells, also called mesenchymal stem cells, and I do practice a very unique manual bioresonance system where I can actually find with these samples of these tissues that were created by biophysicists in an institute in Germany. I can find which tissue is diseased in the body and which infection and or toxin is in the tissue that's diseased in the body. And the purpose is to make the tissue go from weak to strong or from disease to health. So when we can find and remove the infection that's causing the problem or the chemical that's causing the problem in that tissue, the person is only going to get healthier. So I found in her mesenchymal stem cells, I found the treponema bacteria. I found in her meninges, which are the tissues around the brain and the spinal cord, which have blood vessels and nerves that go into the brain and spinal cord, scabies infection in her meninges. I found her lymph tissue, the lymph that helps us fight infection and clear infection and it's supposed to help us get rid of some toxins, part of the immune system and drainage of the body. Her lymph, she had suppressed lymphatic function because she had a chemical in it called xylocaine, which is a lidocaine-based chemical, which is a local anesthetic. So when they inject you in the mouth with a lidocaine to do a dental work, or they give an epidural injection, or maybe they use it for a knee procedure or a shoulder procedure, they're going to inject these chemicals to try to reduce the pain and or to make you numb to do a certain procedure on you. Xylocaine in her lymphatic system, depressing it. She had bacteria, she had Streptococcus bacteria in her lymphatic system, stressing it, inflaming it, and depressing its ability to function well. She had the same Streptococcus bacteria affecting another tissue called the glial cells. Now, glial cells are cells in the body which repair your nerve tissue, protect your neurons of your nervous system, and reproduce the myelin, the coating on the nervous system that allows the impulses, the electrical signals to go from brain to body and body to brain. The glial cells have to be healthy, and when they're infected, pain syndromes, paralyzing syndromes, inflammatory disorders can occur in the body and do occur in the body. So when we can actually provide a specific remedy to get rid of that Streptococcus bacteria from the glial cells, it can only help a person feel and function better, as she is telling you that she is feeling and functioning better. Furthermore, I found her kidneys, she had a chemical called propofol. Propofol is a general anesthetic that they put people to sleep with. The propofol in the kidneys is only going to weaken the kidney function, make the person feel heavy in the legs, back pain can occur, and also can cause blood pressure changes. So when there's blood pressure changes, it can cause constriction, pressure on the blood vessels, constriction on the blood vessels going to the spinal cord, going to the brain, going to your organs, going to your liver, your stomach, your intestines, and it can cause you to have pain, it can cause you to have weakness, it can cause you to have fatigue. So we provided remedy to get rid of the propofol general anesthetic from her kidneys. In her spleen, she had Lyme disease infection, Lyme infection in the spleen, which came up negative on blood tests, Lyme in the spleen, rickettsia bacteria also in her spleen. Now, the spleen is an important organ, and I'm going to tell you more about the spleen in a second, but my purpose here is to help you understand more about the body. You need to know more. I think it's better for you to know more about your body, even if you didn't go to school for medicine, if you didn't go to school for anatomy and physiology and the immune system. I think it's better for you to know more, because then you can make better decisions on what you need to do and what you should do for yourself, instead of just listening to your doctor who tells you what can or can't be done or should or shouldn't be done. The more you know, the more powerful, right? Knowledge is power, right? And then take action with that knowledge. So the spleen helps us remove bad blood cells. The spleen is part of our immune system, it's part of our lymphatic system, part of our cardiovascular system. So what happens when the spleen is infected? The spleen can't regulate certain functions of the body. The immune system, cardiovascular system can become depressed. So that's not good. So again, she had rickettsia and Lyme in that spleen. I found her liver, with the liver, which helps you detox your blood. The liver helps you balance your hormones. The liver helps you with digestion and a few other things. But the liver was toxic with residues of penicillin antibiotic, residues of penicillin. The stomach had penicillin residues, and her stomach had several parasites in the stomach. She had Giardia parasitic infection, she had hookworm, she had pinworm, small microscopic organisms that were found with this unique method that I practice, and remedies were provided to get rid of those infections from her stomach. I found her pylorus, the bottom part where the stomach opens up. At the bottom of the stomach, we have a valve, so to speak, or a muscle that opens and lets the food that was broken down in the stomach by the stomach acids, it drops into the intestines. This area of the bottom part of the stomach that meets the intestine is called the pyloric sphincter. Pyloric sphincter. She had hookworm in there as well. And I found a tissue of the brain called the hypothalamus. Hypothalamus is the endocrine controller. It's the hormone regulator. It's the chief of the whole endocrine system. She had scabies infection in her hypothalamus. Now, when she came back to me after that first round, when she came back, which was in November of 2018, her cough frequency had reduced by 80%. Her cough intensity had decreased by 80%. Her fatigue went from a high level of a 10, or she called it a 12, it went down to a 4 at that point for about 3 weeks period of time when I saw her in November. Now she's had many months. We're talking about 9 months or 10 months into the future, and she's feeling wonderful. So, but that time, after that first protocol, she had a decrease about 60% or so in her fatigue level. She told me in November of 2018, when she returned for her second visit, for a second consult and second exam with me, that the vomiting was, the last time she had come to me in August, it was about 2 times worse than it was now when she returned in November. Now, when we just spoke in September of 2019, there is no more vomiting with flying. Okay, the fevers of 18 years had totally stopped about 3.5 weeks prior to when I saw her in November. So at the beginning of November, end of October, she had no more fevers anymore. She said she had no more leg weakness, and her spine was about 98% okay, and the swelling in the hands, ankles, and feet were gone. And she had no more PMS symptoms, no more anger. Great. There were still other symptoms. Now we move into our exam from November. I found her lungs had 4 different kinds of mold in them, and I also found that she had some, what I can find was house dust particles. And there's a journal that talks about how house dust particles carry bacteria on them. Well, that was what was in her lungs, and now she took those remedies in the first week and a half of her second protocol, and the coughing has not returned in 6 months, totally gone. I found scabies, I didn't point that out. She had scabies also in her lungs. Remedy took care of that, completely gone. I found scabies in her mesenchymal stem cells in that second round. And understand something about the embryonic stem cells. They're part of the whole body. You have, if you were to think about an apple tree that's about 30 years grown, it's matured, it's got apples all over that you can feed your whole community with, this gigantic apple tree. One day it was just the seed that somebody planted in the ground. That seed turned into this big, beautiful, bountiful apple tree. Every fiber of that apple tree came from that seed. So every fiber of that tree is the seed. The seed is in every part of that. So our bodies came from the embryo. So the embryo was part of all of our tissues. We have embryonic stem cells or mesenchymal stem cells throughout the entire head to toe of our entire body. So our mesenchymal stem cells with the scabies, that scabies was all throughout the body. I found her kidneys had mercury in them. I found she had treponema bacteria in her blood. I found she had mercury in her small intestine. I found that the vein called the portal vein that brings the blood into the liver, that portal vein can cause hypertension. That portal vein, when it's infected, it can cause fevers. It can cause a number of stresses to the digestive system. Her portal vein had treponema bacteria and scabies infection. I also found that her spleen had mercury in it, and the spleen had mold, and the spleen had scabies. And I found also that she had in her cartilage, she had mold as well, and she had in her aorta, she had mold as well. The aorta is the main blood vessel that brings blood from the heart out to the brain and to the whole body. So when there's infection in that aorta, and the aorta runs through the whole entire length of the whole torso here, that can cause stress to any organ, and that can cause stress to the spine, because the arteries that feed the spinal cord and the spinal bones, they branch off of that aorta. The organs, the kidneys, every organ in your body, every part of your body gets blood from branches of the aorta. So when there's infection in that aorta, that can lead to symptoms in the body like chest pain and back pain. That can lead to respiratory stress. That can lead to digestive symptom stress. That can lead to head pain. That can lead to pain anywhere in the body. So she is doing incredibly better. She still has some other symptoms that we have to get under control. She still has a bloody nose that we're going to help get well. She still has lesions on the scalp that have not been cleared yet. But her pain is gone. Her irritable bowels, gone. The joint pain, gone. The swelling in the extremities, gone. The fatigue is 70% or so reduced. She's got so much more energy. No more weakness. She can go all day. She's doing phenomenal. She doesn't have the extreme coughing anymore. The coughing is gone. You can get better. It's your time to get better. Let's watch another part of that video again, just highlighting a couple of points, and I'll be right back.
Say, do you have any fevers now? Are you feeling better?
No.
Oh, no more fevers.
No, I have not been bedridden since I started treatment with you. You know, I'm up and about. I can go all day.
Gail, I want to make a point with people here. On a scale of 0 to 10, if 10 is the worst, fatigue, 10 is the worst level it could be. You said it was what level? 12. So it was worse.
It was 12.
Worse than the worst. And now it's been at what level is your energy now? So again, fatigue, let me put it in the same range of fatigue. 0 to 10 is your 12, you're worse. What is the level that you're at now?
3.
And that has been a pretty constant, consistent level of fatigue for you.
Yeah.
So we're looking at even better than 70 to 80% improvement in the energy level of your body.
So I have not had fever since the end of the second protocol.
Okay.
That was May of this year, 2019.
Excellent.
Improved digestion. I had gastrointestinal issues also accompanying all this, what we've mentioned. So for the 18 years, I had, severe bloating. I had either it was constipation or it was diarrhea. It was one of the two. I had these, issues with digestion. Had so much bloating.
I remember you coming here. You had this chronic cough that was not stopping.
Yeah.
How long did you have coughing for?
6 months. I was coughing nonstop, every day, all night.
So now the coughing is totally gone.
Completely gone. Completely cleared.
It's been gone for how long?
It stopped at the end of the first protocol. It was completely cleared. Yeah.
Has that been done?
I had a lot of swelling in the hands and the ankles, the feet, the legs, lower legs. That's gone.
That's
completely
totally
fine.
And I think since I see here my notes, that was from November. I got that note from you, November of 2018. So we're looking at about 10 months, no more swelling in the feet and ankles. How long did you suffer the swelling in the feet, hands, and ankles? How long was that going on in your life prior to coming?
Again, the 18 years, it was when the whole thing started, with the seizures and fever. And this was since childhood. If we were on a flight for maybe 7-8 hours, I would be vomiting for most of that time. And then once I vomited the contents of my stomach, I was vomiting just nothing. I was it was crazy. It was crazy.
And that was a constant for you for years, and that's no more.
That's no more.
No more.
No. Nope.
And how long did that spine pain exist in your life for? How severe was it, and how long did you exist with that? Did that exist with you, I should say?
Yeah, it started when the seizure started. So again, 18 years, and I had pain not only in the spine but throughout the body. So literally from head to toe.
And now is that spine pain, or that head to toe pain that you're describing from the seizures, that whole incidence, is that gone as well?
It's gone completely.
Completely gone.
So now, hopefully, you really can understand that there is a way for you to get better. I'm going to show you another thumbnail of a woman here. This thumbnail, watch this one right now. She has lupus also. 15 years ago, she was diagnosed with lupus. Oh, look at the rash on her body before, and now look at after. Look at the difference. The change is incredible, only from this work. And in that video about that woman, which you can also follow on my YouTube channel, tell you how to go there in just a minute, she took immunosuppressant medications, along with two of them, Plaquenil and Cellcept she took, and prednisone and ibuprofen at the same time. And the problem that happened, her side effect was she had stomach ulcers that developed. The doctors took her off of the Plaquenil and the Cellcept. She wouldn't take it anymore, and they told her, yeah, it makes sense, because the drugs, the medications, they said caused the ulcers because they said it allowed infections to breed in the stomach, and that's why she got off those meds. So for years with lupus, not taking the immunosuppressant. Look at the rash before, look at after. We'll describe that in another video that I can even put that link underneath this video here. You can like me on my Facebook page. I put up information there all the time. You can follow me on Instagram. I put up their information as well. And subscribe to my YouTube channel. And hit the bell for notifications, because then you'll know when YouTube or Google will actually send you an email that says, Dr. Herman put up another video. And watch some other videos on my YouTube channel of people overcoming different kinds of conditions. This work is amazing, and I'm proud to do it. I really hope that you found some benefit from this video, and that it gave you more hope. And that is part of the journey of you recovering, is you gaining hope that somebody can help you, that somebody can actually make a difference in your life. And I really want to help you make a difference in your life and help you get well. Help you get well. Help you stop wondering what's going on, looking for the answers. Again, I told you in the beginning of this video that I was taught by one of the world's most recognized immunologists, and this man has been published in many peer-reviewed journals. He's a PhD in immunology, and one thing that he pointed out to us in the neuroimmunology program that I took in part of my postgraduate study, the documents that he revealed to us from laboratories around the world, scientists who do studies, they found that all these diseases were caused by hidden infections, viral, bacteria, parasitic, mold, or fungus in the tissues of the body, and chemicals that got in the tissues. That's what's going on. And so I went on my journey to find a way that I can actually pinpoint where these infections were in the body and find a way to remove them effectively, safely, and efficiently in the body. And that's what I believe I'm doing right now. And again, listen to her video again. It's pretty impressive. It's really impressive. She suffered for a long time, a very long 18 years of suffering, terrible symptoms, and now she's overcome them with my help, and I'm proud to say that. So you can call my clinic at the end of this video and take action. Call my clinic and make an appointment for yourself or a loved one. The number is 954-370-3100. 954-370-3100. Or you can email my clinic. I'll put up the email address here. And you can contact me, my clinic assistant, and help you schedule your appointments with me. I want to tell you right now that insurance doesn't cover this. They don't recognize my work. They don't recognize my work. There's nothing I can do about that. So this will be an investment in yourself. I do also want to let you know that people come to my clinic from around the world. We have somebody who just came here this week from Nigeria for lupus. People have come to my clinic from Norway and Netherlands and Israel and Thailand and Indonesia and Canada and United Kingdom and Australia and other countries, as well as across the United States, as well as in the state that I'm practicing in now in Florida, United States. So when people who are in really bad health condition, really bad health state, there are people who find the power, who have the family members who help support them and get on that airplane and get here. There are some people who drive 2 or 3 days to travel from Canada or from Mexico or across the US to come to my clinic. You can get well And sometimes it's going to take a bit more stress that you have to incur in order to get here. But there's a chance for you, a high likelihood that you can actually get well with this work. And I'm here to help do it for you. So I'm going to thank you for watching this video. I hope you did find it helpful. And if you did find it beneficial, please share it with someone.